April 3, 2018. On the beaches of Bay St. Louis, Mississippi, young and vibrant Shelby Shoemake and her boyfriend Nick were celebrating her 18th birthday. Suddenly, Shelby developed a headache. The pain grew increasingly severe to the point that she passed out. Nick carried her to the car. He knew he had to get her to a hospital quickly. He discovered the closest was Oshner Hancock Medical.
So I got a call from registration that a family member needed help getting a patient from out of a vehicle. So I went outside to assess the situation and found that this girl was completely unconscious, very young girl, not responding to verbal.
I immediately started sternal rubbing her. The boyfriend was frantic, very anxious. I asked him, did she do any drugs? Did she drink alcohol? What's going on? Tried to get some of the story from him. And he just says that she had a headache and he medicated for her headache, and then that was it. And so we got her on the gurney and got her into the trauma bay.
As we were coming down the hallway with Shelby on the stretcher in trauma bay room 1, the two physicians that were there that day, Dr. LaFleur and Dr. Kirkison, were waiting on us. And they quickly assessed Shelby's airway and her level of consciousness. They noticed that her pupil was blown or dilated, and we quickly knew that we needed to get to CT. We all jumped into action. You have Bethany on one side, myself on the other, a multitude of things going on. You have the physicians at the head of the bed. You also have people that are coming in through triage that need to be seen, but at that particular time, our main focus was Shelby. And during her imaging, I noticed on the screen, even though I'm not a physician, I could tell that there was something terribly wrong with her CAT scan.
Dr. LaFleur was doing a great job with stabilizing the vital signs, so I took on the family and basically had them a little bit aside. Being a parent myself, I knew this family had a lot of questions. Both mom and dad were there.
So at that point, Dr. LaFleur came back in and let them know, that it looked, like a very serious condition, but we were going to fly her out and get her the best neurological care.
The medical team's assessment? Shelby's condition was stabilized, but extremely serious. She was comatose. Of course, Shelby's family had questions. Someone had to tell them what to expect.
We're looking to get ahead of the curve on the next step, which is the most rapid transport safely available. So a lot of times we'll be looking at the weather to see if they're going to fly. That's the next question. Are they going to fly? Will the helicopter come in?
We called flight care, and flight care got there within minutes. So, I think that helped save her life as well.
Whenever we got the request, went through all of our safety checks. Once all of those checked out well and conducive for flight, we went en route to Oxford Hancock for the report of an 18-year-old young woman who had suffered an acute bleed in her brain.
While we were en route, this was actually the first day of the rollout with the Epic computer system at Hancock Medical Center. It interacts with the main computer system at Oshner, Maine, where the neurosurgeon and dispatchers and everyone else can continuously be updated on patient condition and look at CAT scan films and lab results and be able to see the patient's condition pretty much in real time.
It took us about 23 minutes to get there, and once we land, we had Jasper keep the helicopter running like Mark was saying, and say we're going to do a hot load is what we call it.
This was a seamless transfer. It was every piece fell into place just right that day, and we take a lot of credit for what we do and what we plan for and train for here. But overall, there was an element here that we don't ever deny amongst ourselves of divine intervention. The Lord had His hand in this.
One of the things that Oxford is really able to provide is patients who have truly urgent, emergent situations that come up. where a smaller hospital may not have all the facility to manage that in their own institution, but can be quickly brought to a larger institution to provide the necessary care for that patient. And so I think that's been an important part of how Ochsner relates to Hancock in Bay St. Louis. And we've been really excellent partners over the last few years.
It's that partnership and Flight Care's meticulous precautions which allowed the New Orleans medical team to take Shelby directly to the operating room.
This was a local patient who had an emergency situation arise. Was able to be stabilized at Hancock, and then between the communication with the transfer center, between having the radiology immediately available and being able to have a conversation with the ER doctors there, I was able to quickly form a plan that involved having an operative team ready to go when she landed here with us.
On her arrival here, she was very deeply comatose. We had to immediately take her to the operating room. We were unable to really do more diagnostic work that we might do in this setting, but we were confident that this was a vascular malformation, an AVM, arterial venous malformation, that had ruptured in this young woman.
Shelby was suffering from a rare condition known as AVM, arterial venous malformation, a tangle of abnormal blood vessels similar to a blood clot, resulting in a potential brain bleed and, in many cases, death.
And within less than an hour of getting here, we were able to have enough information to actually execute a pretty complex neurosurgical operation. Unfortunately, often fatal, and actually a lot of people don't make it. So the challenge for us was actually to be able to not only get the AVM removed, but also remove the blood clot and relieve the pressure that had built up on her brain.
And in addition to things we've learned from the military, like helicopter transport, we've also learned about leaving the bone flap off, the skull piece off, to provide some room for the brain to swell.
The doctor removed the AVM through an incision in Shelby's scalp and the bone surrounding her brain. The surgery was successful, however, Shelby faced an uncertain recovery.
But right after I came out of that coma, my dad held up one finger to me and he said, Can you hold up one? Can you hold up one, Shelby? Who's your number one? Who's one? And I just whispered, Jesus. I had a perfectly round head before, and now I have a bump that I'm thankful for. It's a scar that is a reminder of everything that the Lord has brought me through.
And she happily made a very surprisingly excellent, good recovery, and we were very pleased with that.
And I think it was both sort of Shelby's drive and her family's support that I think really came together nicely in this type of situation.
So it was really very gratifying to have the coordination between Hancock and us to provide this care for a young woman that was really at death's door, and to be able to save her and bring her back.
I'm grateful to everyone that was placed in my path that day and the days that followed, that played a part in saving my life.